Pass it to me, pass it to me.
Too slow.
The cost of health insurance had become so expensive that we decided to go it alone, go without health insurance, and just pay doctors cash. My employer does offer a very nice health care package. For me to cover my family, starts out at $1,000 a month and goes up to $1,400 a month. Because of that cost, that's the entire reason that I've decided that I simply can't afford to put that much money out when I don't use it. Now, there is a little bit of a risk involved. By not having health insurance, if something terrible were to happen, we would have a very serious problem. We would be exposed to huge, financial burden that we obviously wouldn't be prepared to handle.
What's the aerodynamic is?
Without health insurance, we paid for our last child to be born. That seemed to me at the time to be one of the major medical events financially and as a life event also. And if we could make it through that, I think we could make it through just about anything. I try to go through my mind and think of what are the worst things that could happen. We get in a car accident and break a leg, or get in a car accident, maybe have to spend some days or weeks in the hospital. Even if it gets into $100,000 range, you could easily see spending that much on just the insurance over 5 or 10 years' time. So as long as those things don't happen more often than once every 5 or 10 years, you're pretty well breaking even or coming out ahead. What I'm trying to do is get the most for my money and provide as much as I can for my family. If I were to pay for conventional health insurance, I wouldn't have money left over to do some of the things that we do. I might not be able to afford this house. My kids would certainly not be able to participate in sports and extracurricular activities, things like cell phones, cable TV, internet service, are part of the standard of life that I enjoy. And I feel that I'm justified in taking the risk of not having health insurance and paying out of pocket and just hoping that something terrible doesn't happen. I do not plan on having conventional health insurance unless something changes. I do not see myself participating in the system as it stands now. I am very excited about John McCain's policy of giving me a $5,000 tax credit towards the purchase of health insurance. That would certainly help me. That would be a solution that I would jump on without any question. I do have concerns that could possibly lead to some companies not providing health care insurance as an option for some of their employees. And as a result, that could potentially hurt some people, and they could find themselves in the same position I'm in now.